we are live.
Okay. All right, looks like we are on our side as well.
Yep. Good afternoon. This is United Medical ACO, our weekly live session, March 5th, 12 noon. My name is Kemal Erkan. I'm the chairman of United Medical ACO, and I have Tanner with me again. Tanner, go ahead and introduce yourself, and then we'll start.
Sure. Thanks, Kamal. My name's Tanner Fuchs. I'm a member of the business development team here with United Medical.
All right, so now everyone knows you already, right?
Yeah.
So we're going to start with our regular updates. Before, let's actually share the screen. And the only heads up that I want to give everyone, I think in the area there are some internet connection issues. In a couple different offices, we lost internet earlier. If that happens, we'll try to pick up from our cellular backups, but hopefully it won't happen. So we try to bring up these, oops, sorry guys. So the different services, what United Medical ACO does, we are a full service healthcare solutions for private practices. We utilize Cerner practice management and EMR systems, medical billing, credentialing, IT support, application training, population health, insurance company contracting, accountable care, care coordinations, human resources, website design, email hosting are one of those different service lines that we have. Now, just so that better understand our Delaware population, because we do something unique in Delaware. We have our population health and value-based contracts in Delaware, and that's with 116,000 patients, unique patients at primary care level, and about 430,000 appointments in year 2020. Because of our telemedicine transition in early 2020, we didn't lose any patient appointments, and we were able to serve our population here in Delaware. So today we have different, again, topics. We always cover COVID-19 numbers and the vaccine updates, and we do have our research-based data that we are going to actually discuss that. And also on some examples from the management approach and what makes us different, what makes us unique. And then also we'll talk about our private practice advocacy efforts, and that's what we have for today. So I'm going to bring the Worldometer website for the nationwide update. Here we are at, as of today, 2 days ago at 67,000 people. Yesterday it was 68,000 new confirmed cases, and today so far it's low because this number is live, so it's going to actually, it's only 12 noon Eastern time here. So now in Delaware, we have our numbers for current hospitalization with, we are at 130,000 total, and then new hospitalizations at 31,000. Percent of persons testing positive, we are at 19.4%. Last week when we did this session, I think it was at 20.6%, and then percent of tests that are positive, we are down to 4.7. It was about 4.9, I believe, last week. And new positive cases, we are at 268. About a month ago, that number was about 700-ish. Now we are doing pretty well with that number as well. We are gonna have our updates on the vaccine, and what people should know with the vaccine. So I'm going to have Tanner to help us with what's happening in Delaware and like overall with the vaccine process. Some of them may be some of the stuff that we already covered, but there are some new stuff that we have. Tanner, go ahead.
Certainly. Thanks, Kamal. This is something that we started to share with everyone over the past few weeks, but I like to keep bringing up. It's interesting to see exactly where and how many vaccines are going through this current process. So again, although we only have a handful that are approved for emergency use federally here in the United States, it's interesting and important to note that there are a vast majority of undertakings around the world, not just here in the United States, to have vaccines developed to help fight and control the pandemic. So just looking here at some of these numbers, again, I know this is something that we'd shared last week, but just since that last week, we've had some big changes in different vaccines along the way within the process. One of the biggest being, I know this time last Friday, the Johnson & Johnson vaccine was actually under review by the FDA for federal emergency use. That was approved. It had gone in front of the advisory panel. They took all day last Friday to discuss the information, the clinical trial data, and they went ahead and did approve that for federal emergency use. So that has already begun to ship and is actually going to be a third vaccine here in the United States in our line against COVID. So just some of the other numbers here, we see the phase 1. There's quite a few that are in phase 1. There's a few new players there around the world. I don't believe anyone here in the United States, but we did have that Johnson & Johnson one move to approved, as well as another one overseas that was approved as well. So that brings us to 6 total vaccines that are in use around the world. So as I had mentioned with the Johnson & Johnson one, it was approved for federal use. Kamal, if you want to go ahead, we'll share some more data and some more information about that. So the single shot use is the big difference here. We've talked about that, comparing them to the 2 that we already have available, the Moderna and the Pfizer. That's a big difference in helping fight the global pandemic. It's going to help alleviate a lot of logistical issues we're seeing with the administration of 2-dose vaccines. And one thing too, and we'll get into a little bit of the comparison again. I know we'd like to share that side by side. But we do, again, have this as a new tool in our chest to help fight the pandemic. So they're already shipping as of this past week. And this is something that I thought was really important and interesting to note, that with this new Johnson & Johnson vaccine, originally they were on pace to kind of miss their mark for how many vaccines that they said that they would be able to manufacture, produce and ship, distribute, and administer in their first 90 days, I believe. So what they did was they're partnering with Merck, which is another large pharmaceutical medical company here in the United States, to help actually produce and distribute that vaccine. And with that partnership, we're now looking at, I believe one of the things that we discussed previously was with the new additional purchases of the Pfizer and Moderna vaccines, we were going to reach about 300 million vaccine doses, which would be enough to, or roughly enough to vaccinate the entire population, adult population, at least in the United States. By the end of summer, I believe was the original mark, but with this partnership, we're looking closer to that being at the beginning of summer. Sometime in May, we could have that reach that same number, which is really exciting news. And again, something to note with that 1-dose vaccine, that should also help kind of speed up that administration process, as we're not having to hassle with the schedule of the second vaccine, making sure we're coordinating that effort. So then just to kind of take a look at these side by side, now that we are having a lot more data with the Johnson & Johnson vaccine, we're kind of able to really stack this up against the others now that it is going to be administered for use here in the United States. So just a couple of things to note with its efficacy. All 3 are 100% effective from their clinical 3 trial data in preventing death and hospitalization. The Pfizer and Moderna vaccine are almost certain to prevent severe disease, where the Johnson & Johnson is about 85% with preventing severe disease. And then, as we see here, 72% in the US for symptomatic COVID, But one thing to note is those numbers are a little bit behind our Pfizer and Moderna counterparts. But one thing we like to reiterate is for a single shot vaccine, that stacks up pretty good. Those are good numbers, and it shouldn't deter anyone from getting that vaccine. We look at things such as the flu vaccine, which that is definitely surpassing in efficacy for a single shot dose. So that's great news to hear. Again, you can see here that the big difference is that one dose. So there's no interval in between the administration dates. And then it's also going to be similar to the Moderna or a lot of our regular vaccines that are being stored here at -4 degrees. So that's really going to help again on the logistical side with transportation, distribution, things like that, storage in your facility. Offices aren't going to have the super coolers like they're having to do to store the Pfizer vaccine. So we're really excited about this one going forward. It's going to be a great tool in the fight against the pandemic. So I kind of started to talk about, okay, so with this new vaccine, we really want to start seeing the amount of doses being delivered. We're hoping to see that kind of increase here over the next few weeks, if not months. So that way we can get to that those points of having enough vaccine for everyone in the United States by the summertime. So just kind of taking a look at where we are right now. Across the top here, we're looking at some of those key metrics we're keeping track of. So how many have been administered? We're roughly here at about 82.6 million so far, and this is data coming from the CDC. So anything that has been reported. Now there might be a slight little delay and lag. We've seen some lagging in reporting data, but this is their most up-to-date data that we have here. So just some of the other key metrics though that we're keeping an eye on have always been cases in the United States, as well as deaths in the United States. And those are both trending downward, which is a good sign as we are starting to ramp up the amount of vaccine that's getting out and that are also being administered. So we have about 16% of the population that's received at least one dose, with 8.4 receiving the 2. Again, this is going to be something that we're going to be interested to keep an eye on, especially as with the Johnson & Johnson vaccine coming in, there's not going to be a necessary second dose there. So we'll likely see these numbers start to pick up here in the next few weeks.
So, Tanner, when we are talking about the COVID-19 and the vaccine for COVID, I think one of the things that we mentioned, which I do have live data for us from our population health system, we want our people to know what we have so far. There are 431 patients from United Medical ACO level. So one of our medical students, future medical students actually, went over the data, and we also verify what we have. So this is from our tracking. So each number here is representing one record. So if I were to click on here, there will be 50 patients. Of course, I'm not going to do that because we are on a live session. However, this is 431 people over 50 years old. And the really important part that we see here is the level of obesity and morbid obesity. So it's about 60% of the population that we have who had COVID positive over 50 years old has BMI level over 30. So I think this is really important from that point. Now, the same data, I'm going to take you to this next report. This is for those patients who have hypertension. That's at 65.7%. So this is the number one biggest illness that this group of patients who had COVID in the last year over 50 years old. The same data for the diabetes, they're at 34%. And then when we go to the heart disease, that's about 19%. And then on the sleep apnea, that's about 16%. And then at the vascular issues, that is at oh, actually, I was just told that I'm not sharing. So sorry about that.
Oh, I'm sorry. I would have said something, but I wasn't sure
Yeah,
if you wanted to bring this stuff
I
up.
guess I was really clear, so you didn't even know. So I'm gonna just take this part again. So this part is the obesity. That's 46 plus 14. That's about 60% on the obesity with the different ages. So 431 total. And then when you go to hypertension, that's about 65.7%. When you go to diabetes, that's about 34%. And heart-related issues, it's about 19%. And then sleep apnea is about 16%. And about 7.2% on the vascular disease. So I think this is important for so many different at so many different levels, because the way that we are looking at here is some of these patients, they have multiple problems, more than one. So therefore, we are going to actually look at this very carefully and make sure that we can make more out of this data. So in United Medical System, the total number of tests were ordered. It was a little over 8,000. What came back with positives was about, I think it was over 1,000. So we are going to actually just look at this data very closely to see if we can actually build anything on top of this.
Sure.
So now I just want to finish that here, and I believe we are going to go. The other good news that you have, I believe, is the way that we are daily administered vaccine, right? So that number is around like 2 million.
Right around 2 million, yeah. And that was, of course, that's really good news because that's trending towards back to that number where we were discussing a few weeks ago, where we want to be able to reach herd immunity towards the end of the summer, early fall, which is really good news because we did see that dip that we were discussing last week or the week before as well, with some winter weather storms around the country, as well as some other issues that were getting in the way of administration of the vaccine. So again, this just reiterating, the new vaccine is going to also help with the amount that we're getting out here, doses per day. So you see that dip there the past few weeks. So we're starting to get back up. That's great news.
All right.
So I think that was all I had with vaccine stuff. So I know the past few weeks with everyone that we've had on, we've done a lot of our, had a lot of guests on and outreach with our local leaders, state leaders. So we wanted to kind of take some time this week to kind of get back to discussing a little bit of what's going on with ourselves, with what's going on with the ACO, kind of some internal news and updates. So this was actually something, Kamal, wanted to discuss a little bit. You brought up that you're taking on a new role.
Yes.
So could you tell us a little bit about that?
Of course. So the Brandywine SPCA, they approached me through Dr. John Agora. And initially I didn't know. And then SPCA, initially, again, it was not something that I was really crazy about just because of the certain policies. But Brandywine Valley SPCA actually did no-kill shelter. So animals will be there, similar to the Humane Society. And when they approached me, I had to think about it a little bit, of course, but once I get to know how much they are able to help, I think it was no-brainer for me to be part of it. And I'm actually extremely happy that I'm going to be on, I believe I'm going to be on their advisor board starting sometime soon. So that means all of my friends, they can expect me to reach out to them for donations. So I won't be shy about. So that's what's happening today. I mean, days. So Tanner, what else do we have from here?
So we also wanted to take a second to, I don't think that this is actually something we really got to discuss once we started to really get into our live sessions, starting really last fall. So As we've kind of talked about and we've discussed, we know that these live sessions have been a key part of our business practice since the onset of the pandemic, really with some things such as our patient communication and our public awareness of what's going on. So since the past year, with everything that was changing, progressing, improving upon business-wise, we certainly hit a handful of some pretty big hurdles and some challenges with the pandemic when it came to basic prior business practice and how we were conducting ourselves. So a lot went on this past year, and there were certainly lots of lows, but we also ran into some highs and some definite silver linings. And this was one of them, Kamal. So just kind of wanted to take a second to show and discuss the Lifetime Achievement Award through MGMA. Maybe you could tell us a little bit about exactly what MGMA is, what they do, just so that everyone is kind of aware of how important this is.
This link first?
Sure. Yeah. If you want to go, you got to press control with that one, but that'll actually bring up a little bit about what I wanted to include in what we were talking about.
And now, our final award, MGMA, could not be what it is today without individuals who are catalysts for positive change in medical practice management. People who dedicate their careers to advancing the profession of this industry. The Lifetime Achievement Award celebrates the success of an individual who has inspired and empowered other leaders through significant contributions to the healthcare industry. This award recognizes their great contributions to medical group administration, care delivery, and/or education. Today, I have the pleasure to recognize Kemal Erkan as the 2020 MGMA Lifetime Achievement Award winner.
Good afternoon. I'm honored to receive the MGMA Lifetime Achievement Award. To receive recognition from such a prestigious organization is truly humbling. Especially that it should come during such a difficult time makes it even more meaningful. Well, I'm a little bit embarrassed now, but I'll get over it.
I know you didn't know I was going to include some of this information, but I thought it was important because it was a big achievement for this past year. And I know that they kind of talked a little bit about MGMA there and what they do and how it relates to private medical practice, but could you kind of just give us a little bit more information?
Sure. Now, one of the, this is my, this is 2021. In May, it's going to be 21 years. I'll be in the healthcare industry. So just to give you a little bit background on what my life was, initially in the beginning of 2000, 2001, and part of 2002, in the business office, I was actually doing my internship. It was a paid internship, but that's how it started when I was doing my second bachelor's. So the business office I was working was Delaware Cardiovascular's business office. It wasn't a billing office. It was just a small business office then. I think we have 12, 13 people there. A lot of people, most of the people were on the AR billing side. Many of whom didn't have the proper education. So after I got in charge of the office, it was about 18 months later, fully, almost the entire office we replaced with better educated people in the area. So, and it wasn't common. Most of the doctors' offices, if you look at them, many of whom the family members are involved. And then they work with, doctors are not really lucky when it comes to business. They work with a lot of difficulties in terms of the support that they get from their office. Imagine this way, like doctors are the most educated in their field. And in any of the private offices, when you look at their MAs and check in, check out, that's the lowest paid people in that group. And from the education side, that's also the lowest education. So then there's no in-between layer to support them. So now why this is important? One, we need to be able to recognize the problem, identify the problem. Two, we need to make things better for our offices. Like when we start owning medical offices, one of the things that we did certain benefits were standard as they were standard for the hospital system. So we didn't want our employees to have anything less. And competing with that, financial difficulties that private offices have. And this is actually kind of coming back to the issue of why we are the advocates of the private practices and why we get the proper, we want the proper recognition is because when we are dealing with these difficulties under the label of nonprofit, hospitals are getting a lot of unfair advantages over the private practices, because with the not-for-profit situation, the status that they have, they can use that for so many different things. They get donations, they don't pay taxes for certain things, and they have the economy of scale at the end of the day. So now, but we understood those advantages that they had, and for us, we either needed to take this battle and fight, or we were going to give up. So we decided to fight. So in this fight, you have to have good, strong resources, educated resources with you. Now, healthcare is not like any other businesses, and healthcare management. Actually, I was probably in Delaware. I was the first one who set up the healthcare management concentration at Goldey-Beacom College. This was year 2009. There wasn't any structural education. And there is still not a good structural education for those. Then in this process, Mgma partnership actually really helped us. So when we realized that this certification is going to be useful, actually, if you look at the structure of it, it's pretty much like any other businesses, but more on the concentration on the healthcare side. So then we said, okay, well, this certification process is a must for our managers. So I know in the last like 3-4 months, you are helping us with some of these meetings and putting some of the tests together, and you understand the process. The issue is why we are doing it is because we are going to share some problems later on. We want everyone at every level, as long as they're in the management, they have a proper structure, proper foundation to understand what they are dealing with. So you can see a problem, you can take that problem and make it a bigger problem if you don't have the proper background on that issue. Or you can see the problem and then you can resolve that issue by identifying and treating that problem. It's almost like business people are almost like physicians in business. So when I meet with business owners, doctors' offices, I treat them like, okay, well, this is a patient. Okay, if this patient was in the medical setting, my client is in the business setting. So we start the treatment options for them. We give them different support. We give them different equipment. We give them different plans and make changes, right? So in order to do that, it's not going to be done just by me. So, and I actually did for several years, I tried, and it was so difficult to get everyone at the same level because that's standard education. We are actually, United Medical is paying for this. It's almost like, you know, how the financial industries, for someone to be a financial planner, they have to go through certain tests. Like, I am not promoting anyone in this organization anymore if they are not willing to get the Mgma certification. So it's very simple. Actually, in fact, in the last couple months, there were some options with the promotions, internal promotions, but this is a must for us. This is our standard for United Medical. But other organizations are doing it as well. But I don't see that our level with the private practices who's actually supporting this. We also made the Mgma available to everyone. Now, just like the doctors, when they have to get their CME credits, like the continuing education credits, we have to get that too. in order, like when we are doing these sessions, we prepare, right? We do a lot of preparation for what we are going to share, even the vaccine stuff. Some of those are available, but some of them you have to go out of your way to find it. If you don't spend enough time on new educational materials, you are going to lose. You're going to be outdated in 6 months for your company. So we have to be the best, and we have to be on top of our game. So this is a good time to actually invite Muriel Campos. So Muriel, you can join us. And you need to remember, I imagine when I said this is why we have the best people, right? So Muriel is one of our senior client managers. This is her second time with us. So this MGMA process is pretty much, giving that support that I'm not able to do anymore. But with this, what we have done, we had group meetings, group sessions, and people work together. I conducted some of the meetings. So it made it really enjoyable and also beneficial for those employees, those managers. Now, what I would like us to kind of do is how we are actually utilizing these tools. And because the challenges are not going to be, not going to go away. Like it may be 1 week, no problem, but next week, so many problems. And the work that we do is, if there is a problem happening once or twice or 3 times, if it's once, fine. But if it's happening more than once, we always need to find a solution, go to the root of the problem and fix it. So I'm going to ask Muriel to introduce herself, and then we are going to give you an example of how we are utilizing some of these tools.
Thank you, Kamal. So as Kamal mentioned, my name is Muriel Campos, and I'm one of the senior client managers here in our revenue cycle management team. I've been with United Medical what feels like all my life at this point.
So that's, you were 18 when you started with us.
Yes.
No, you're still 18.
Yeah, let's go with that.
Well, how many years, honestly? It's been since you first started with me? Is it?
Oh, well, definitely 18. I want to say 15 years now.
Oh, good choice. All right, so Muriel, I want to actually just show our patients, our employees, what how we actually try to help the issue of these communications with the offices, with us, and then what you have to do with from your side. So let's go ahead and start. So one of the biggest problems, I mean, if you really want to hate your doctor's office, try to call them. So we won't answer. So we won't answer in the second or the third or the fourth ring. It's going to take several minutes. And then if we answer, we are going to ask you, can you please hold? Then we'll come back in 15 minutes. I'm not just saying that this is us, this is anyone. The billing offices, they don't change either. So you really, if you're a patient of United Medical ACO and you're trying to reach out to the billing office, the best way to do is not the phone call, because it's not good. Chances are you're going to wait. As long as you're okay to wait, that's fine. But there's a solution for that, right, Muriel? So we have we created this patient inquiry form. So Muriel, if you want to kind of discuss, to tell us what this does.
Sure. So basically, the patient inquiry form sends a notification to our revenue cycle management team that a patient is trying to reach us for billing questions, or they want to update their insurance information, pay their bills, things like that. And it's just more a streamlined and secure way to make sure that we're answering all the questions that we're getting from patients.
So when we start doing this, Muriel, so I remember it was last year mainly, but this form is so simple to fill out. They don't need a login. And
No.
one of the things that I skipped actually, every patient should be using their IQ Health, the patient portal.
Mhm.
Once they start doing it, actually, all the links are available through that on the homepage of that. So when, for example, when they call, these are the options that you have, right?
Correct.
So then they, as soon as they fill out this in 24 to 48 hours, we are able to go back
Correct.
to patients, because the issues are not going to be urgent when they are calling the billing office. We are not a medical office, so we are not dealing with the patient care at that point anyway. Now, Muriel, this is like identify, improve, and substantiate with data. So what we were trying to do here is between 2020 and 2021, this is for 2 months comparison. This is the calls that comes from the patients only, because
Correct.
we are going to show them how we actually changed this. So we were getting 519 forms from the patients. So that went up to 785. So that's more than 50%.
Mhm.
However, what was happening was patients were saying that, well, we call and we leave a voicemail and then there is no accountability. Well, then we said, okay, we take those phone calls. Our people now in 2021, we are entering them into our system so that we can have a good tracking method. And this is also important for our clients, because when they see this, they understand that accountability is one of the most important part of what we do. So although like 785 requests came from the patients through our web-based system, about 1,318 we actually entered for patients from their voicemails, right?
Correct. Yes.
So now, then when we put it all together, so now we have data for 4 times more than what it was for 2020. So the reason we have this, so Muriel, so I know you were one of the main managers when we were going through this. When someone comes to us with a complaint, we want to be able to have some tracking and trace the data and then look at it, what happened when, like if the patient says, I called your office multiple times. Well, multiple times is, if it's 2, I'm not going to use multiple times. Multiple times for me is like 4, 5, 6. But then when we look at this, we are able to capture and put the accountability into the picture. And that's the most important thing for us. So now, how did this change your team's behavior in terms of returning these messages in a timely manner?
Well, the major change I will say is the accountability, because we are able to visualize, what the patients are giving feedback on. So if they're saying, I've called your office 3, 4, 5 times, we're actually able to visualize that information. And it holds not only the management team accountable, but it also holds the representatives that take care of the inquiries on a daily basis accountable. So there's multiple layers of protection there to make sure that we're getting back to all the patients in a timely manner. Mm-hmm. But that is the major one, I will say, Kamal, is accountability.
So we have, we adopted, and my team would know this very well, trust and verify, checks and balances. So we do want, I think the accountability is the most important piece. Anything that we are able to do at the accountability level, just like the accountable care organization in the healthcare, it's going to be important. Mm-hmm. And then that's what we do from our side. And now this turns into, like, although we are doing this with the patients, this turns into the client satisfaction at some point. So, and Muriel, I'm going to share this with everyone. In 2020, our client satisfaction rating was at 96.7. So far, we have 14 responses back in 2021. That's 100%. Our clients are happy. I believe when we take this at a different level and then show the accountability and show that we care, I think the results are always positive.
Exactly.
So that's extremely important, and I'm extremely pleased with the results that we are getting. And this is going to be kind of like the key for us. So that's why something like MGMA infrastructure of the education and training, once our managers are independent in a way that we work together, but then we want everyone to excel from what they do. And that's kind of like why we have to invest in those types of training and education systems in United Medical Management team. Well, Muriel, thank you so much for joining us.
Of course, no problem. Kamal, I do want to say one little announcement just for the public out there, if I can.
Sure, of course.
So I was reviewing the patient inquiries that we receive, and I just want to kind of announce it to the general public out there that oftentimes when patients do have questions on their bills, they're better off calling their insurance companies right away, because oftentimes when the balances are dropped to patients, it's from instruction from their insurance companies telling us the patient's responsible for this balance for whatever reason. So just kind of like want to put that idea out there that a lot of these questions or issues can be resolved firstly by contacting the insurance companies, because at the end of the day, we're just going by what they're telling us to do. So just in case if anybody, doesn't really know that, it's really important to first reach out to the insurance companies that they do have, just to get some kind of quicker resolution as well.
Yep, that's very important.
That's my little PSA.
Thank you for that. And
thank you, Kamal.
Thank you. So right in front of my office, there are some very loud and happy employees. I'm glad to hear them that they are happy, but at the same time, I need them to stop. So they're definitely not listening. Okay.
Well, they have a little bit of a delay.
Right.
They're just happy it's Friday,
I guess.
Right.
Hold on 1 second. I think I gave my message very clear and loud. So I'm going to go ahead and share the last part of our presentation.
Sure.
So one of our advocacy efforts that we have is the bringing different guests to our events. And last week we had an event with David Benz and Dr. Rick Hung, Brian Townsend, Valerie Longhurst, Jan Lee, she's the CEO of DIN. Now, I think Brian Townsend is not fully confirmed yet, but he's coming back next week.
Yes. He should be available next week. So we're excited to have him back, especially since we've kind of delved into some more topics. Be interested to have him and see where he's at, how he can help, and just make him aware of some of the topics of issue that we've been discussing.
Sure, and we are going to actually bring up the issues that in a summary way that we already discussed some of these very clearly. From the time of the level of representation of the private practices, the level of participation in the state committees for the decision-making parts, and then from the process of the insurance companies trying to take the money back from us, although they don't have to pay in the same time frame. So there are so many different issues that we have, and we are going to actually take care of those problems. We are hoping that we can take care of some of those problems on behalf of our providers and medical offices. And so hopefully they will be supporting our cases. Now, that's all we have for today. Now, 10 of our events, our channels that are up to date. I just want to kind of show them before we leave. The behavioral health resources, these are the playlists, the UMACO Weekly events, if in case you don't watch these on live. And this actually is from our diabetes group. Amy is back with her quick tip videos. And then CREAS and ASC events, the events are happening, and you can actually find them on our YouTube channels. Now, every Friday, we are on with this event. And I believe that's what we have. So again, thank you so much for being with us, and then we'll be back next week, same time. We are hoping that this is useful for the public, and until next time, please stay safe. Thanks. Bye-bye.
Thank you, everyone. Bye.